Hello, my name is Dr. Louis Vita. I'm a general dentist from Clifton, New Jersey. For the past 28 years, our practice has been focusing on treating patients with TMJ disorders, head, neck, facial pain, and headaches. Throughout the community, we typically lecture to both physicians and dentists on recognizing the effects of a TMJ disorder. Today, I would like to discuss just a few aspects of this condition of TMJ. But before we do so, I would like to discuss what TMJ is not. TMJ is not a mystery condition. There is no enigma. We can absolutely diagnose each and every patient that presents with a problem. This is not a condition that's totally due to stress and anxiety. Yes, patients are stressed and anxious because they're in pain. And typically you go from physician to physician and without any relief. This is not a muscle tension problem, although yes, pain is within the muscle, but it's not a muscle tension problem. And patients are not psychotic or neurotic or depressed. They are in pain. I often have patients that come to me and say, "Oh doctor, I have great pain. I have TMJ." Now, it's perfectly acceptable for your physician or your dentist to say you have a TMJ problem or TMJ. But when you come to our level, we have to be very, very specific with the diagnosis because TMJ is not a diagnosis. We have to be very specific. What is wrong with the TMJ? What can cause TMJ problems? You are not born with a TMJ problem. This is an acquired condition. This is not congenital. Typically, our patients present with some type of history of trauma. It can be a sports-related injury, a fall off your bicycle as a child. It does affect children greatly with relation to their sports injuries. So, patients are treated for TMJ problems because of some type of trauma that they've had throughout their life. When a patient has a problem with the TMJ, they typically will have headaches, TMJ clicking, ear pain, neck pain, and poor sleep quality. So what is the appropriate diagnosis for your TMJ? Well, it first starts with a soft tissue injury, very typical to that of the knee. All right? Typically, we have the soft tissue that's normal in this position, and upon injuring the joint, the tissue can become postured in a different plane. So we'd like to know, as part of our diagnosis, where is that disc or that tissue? Also, it can affect the bone. We can go from a perfectly normal bone to a completely degenerated bone. So you see, TMJ is not a diagnosis. We'd like to know about the soft tissue, the disc, and the bony anatomy as it changes. Therefore, we can consider the different diagnoses and treatment. Common belief also is that, "Oh doctor, I have TMJ because I grind my teeth and I am under stress." Well, clenching and grinding is a manifestation of a problem. It is typically not the problem itself. Let me say that again. Clenching and grinding is a manifestation of a particular problem. It is not the problem itself. When we clench and grind our teeth, we call that Bruxism. Bruxism is when we put our teeth together in the absence of food, when there's really no reason to put our teeth together. Okay? And typically, when you think of somebody that grinds their teeth, we would see that you have very, very worn and flattened teeth. So this is what a typical patient would present like. Also, we have bony expansion. So there are different signs that any dentist could look for to recognize that a patient may be clenching and grinding their teeth. As well as inside the mouth when we have broken fillings, broken porcelains, and the like. So your dentist can very easily look inside your mouth and say, yes, you have been grinding and clenching your teeth. But there are certain causes of this bruxism. Sometimes it is a disorder of the TMJ or the neck, the upper cervical spine. It can be a structural problem. It can be contributed by certain drugs and medications. Typically those that are given because of anxiety can cause muscle tension and muscle hyperactivity. Different changes in the bite can also contribute to bruxism. or sometimes it's from the central nervous system itself, from within the brain. But you see, a lot of people think that stress is really related to bruxism. In our thought process, stress is typically associated with sleep deprivation. So patients will be grinding their teeth anyway. You add a little stress into their life and they become sleep deprived. When you become sleep deprived, you cannot respond to different stresses within your life, and pain can develop. So often patients will come to me and say, I've been grinding my teeth lately because I've been under some stress. When the fact is you've been grinding your teeth all along, but now if you add stress, there is pain and you become more aware that you've been grinding your teeth. When patients have TMJ disorders, there are different treatment options. It could be medication, surgery, or very typically a night guard or some type of bite plane, which is the most popular. It may not be the most appropriate, but it is the most popular treatment for patients with TMJ disorders. Now, there are many different types of splints, and many times patients will present in my office with multiple different types of splints. So what is the right diagnosis of the TMJ with respect to the disc and the bone? What are some of the causes that are contributing to this TMJ disorder, and how do you properly treat this? These are some of the aspects that we discuss. If a patient has an inappropriate splint or a splint or some kind of night guard that's not proper, changes in the bite can occur. So you see, as you can remember in our first slide where the bite was worn out, these particular people will have bite changes. This can be caused by an inappropriate use of a splint. So, I'd like to thank you for your time and encourage you to please visit my website to help with any questions you may have. Thank you.